Hey there, it's Lewis once again, and today we're going to be talking about an initiative that was announced by Walgreens, the VFW, and the Department of Veterans Affairs here in the United States to help improve mental health care for veterans through enhanced education and access to resources and outreach. Some of the things that they're working on is mental health awareness and treatment, veteran suicide prevention, and opioid overdose education. VA Secretary David Shulkin has said, "Our work is driven by commitment to encourage veterans to get the care and services they need and integrate mental health care as part of their overall wellness and healthy lifestyle." He also goes on to say, by joining forces with the VFW and Walgreens, it provides the VA an opportunity to further expand our reach and connect with veterans, their families, and the community to raise mental health awareness. That's telling me that this new VA secretary is taking the opioid problems very seriously, because there are a lot of veterans who are dying from overdoses, from heroin, from prescription medications that they should be taken safely, but veterans are not always following the rules of the prescription, and it's causing them problems. As part of the collaboration, the three want to educate VFW members to reduce the stigma associated with mental health conditions. So that would be a good thing. If the VFW gets involved in reducing the stigma with things such as PTSD or other items or other mental health conditions that a veteran has, that's going to help with the problem. This outreach effort is also going to include Walgreens and the VA programming at several upcoming state VFW meetings. So they're trying to get the word out. It's a joint promotion, and they're going to coordinate with the Make the Connection campaign, which is to fundamentally change how people think and talk about mental health. A lot of people don't want to talk about mental health, but the VA is wanting to get the veteran stories out, and also their treatment and recovery, and show other veterans that it can be done. They're also going to share patient education materials to build awareness of both the VA and Walgreens initiatives to prevent opioid overdose. That'll be through education. Also, the proper disposal of unused medications and access to naloxone, also known as Narcan. It's a life-saving medication that's an antidote to an opioid overdose. They're also going to be working with Walgreens pharmacist and healthcare clinic nurse practitioners to enhance providers' ability to recognize veteran-specific needs and better understand the military culture, which may influence the veteran's willingness to seek help. According to Dr. Poonam Ali, the acting VA Undersecretary for Health, who says, "We know that the rate of suicide is increasing for all Americans, but the rate of increase is much lower for veterans who receive VA care. With this in mind, we need to cast a wider net and meet veterans where they live to better engage them in care." And if the veterans are seeking help through the VA, that means that they can get the help quicker if they need it. According to the VFW National Commander Brian Duffy, the mental well-being of America's veterans is of the utmost importance to the VFW. By working with several organizations, including Walgreens and the VA, we're able to positively impact a great number of veterans and help to change the narrative associated with mental wellness. He also goes on to say, we're proud of the collaborations we've developed to provide greater access to pharmacy and healthcare services for current and former members of the armed services, including retirees and their families. That was actually Brad Flugel who said that. He's a Walgreens Chief Healthcare Commercial Market Development Officer. He goes on to say, we look forward to working closely with the VA and the VFW to help heighten mental health awareness and hope to improve the health and well-being of more veterans by connecting them with the VA and VFW and other resources that can help. The VA is actually giving out 60,000 naloxone or Narcan, or actually, I take that back. To date, the VA has issued naloxone to more than 60,000 veterans to prevent overdose. That's the ones who seek the treatment for an overdose in case there is an accident. That's not talking about those who have not sought help. Separately, other pharmacies, including Walgreens, they've all started installing what they call medication disposal kiosk. That is where anybody who has an opioid type medicine can go in and get rid of the medicines they may not be taking anymore, such as one of the things I always had problems with was Vicodin. You can actually go in and dispose of any used Vicodin or anything like that, and it won't cost you anything. And you can also get naloxone available without a prescription from a lot of the Walgreens. It depends on the state. But you can always find mental health services information if you're a veteran by going to mentalhealth.va.gov. You can also find information out about the VFW and what their programs are at www.vfw.org. And you can also find out more information about what Walgreens is doing by going to www.walgreens.com. Again, this is a collaborative effort between the Department of Veterans Affairs, the VFW, and Walgreens. They are wanting to help our veterans kick the habits of opioid abuse. They also want to prevent the rate of veteran suicide.